Hey everyone, it's Dr. Brace here for Facial Plastics Friday, coming to you from Killbear Provincial Park, where I have my annual family vacation camping trip with my wife and kids, and most of my wife's immediate and extended family. It's like a big family reunion, and it's just really every year the week that really lets me shut off completely, hand over the reins to the clinic to our very capable nurses, and come and think about the year that's passed, the year that's ahead of us, to brainstorm and plan kind of where I want to be going in terms of what Guelph Facial Plastics is doing, what we're offering, what direction we're heading in, and those sorts of things. So it's really a week of some personal and professional development and thinking and planning for our annual planning meeting, which always happens in January, but that all really starts here on this beach at Kilcorsie Campground in Killbear. And so some of the things I wanted to highlight that will be coming up this year for Guelph Facial Plastics is that we have some new technology coming this year. It's time for us to reinvest in the offerings that we have for our patients who want limited downtime procedures, but with great results. So we have a CO2 laser, we have a pulse dye laser, we have Profound. The Profound and the CO2 get great results, but there's downtime, and we want to expand what we offer for people that really can't afford that downtime. And so that is in the works to be brought into the clinic this year, hopefully this fall. The other thing that we have going on is, as many of you know, we have Dr. Karan Gandhi joining us July of 2026. He'll be our very first fellow, and that fellowship is accredited through the University of Toronto. But this fall, when I'm in LA, there's a board meeting with the American Academy of Facial Plastic and Reconstructive Surgery, and they'll be voting on whether or not they will accredit it. So my hope is that Dr. Gandhi will get both a University of Toronto certificate and an American Board of Facial Plastic and Reconstructive Surgery certificate, and so will every fellow after that, which will be a yearly thing. That means that we'll have 2 surgeons at Guelph Facial Plastics providing care for patients, which will mean waits will go down, especially for skin cancer patients, because that's the one area where I just don't have enough time to treat everybody that's referred. But having a fully licensed, fully qualified head and neck surgeon coming in to refine his scope or her scope of practice as a facial plastic and reconstructive subspecialist will allow us to get more people through the clinic. We're probably going to grow in other ways. I have some things kind of brewing in the background that I'm not going to reveal yet, but there's other growth strategies, other new offerings, and some pretty cool things that are in the works. And so this week, as I rest, as I think, as I reflect, I encourage everybody else to do the same thing. End of summer is a great time before the academic year starts to really stop and be intentional about where you're going and what you're doing. If you don't have a plan, you're not going to end up where you want to be. And so it's important to set a course, to set some goals, to mark out what you want to be doing, where you want to be, who you want to be with, and then make it happen. So that's my very non-clinical Facial Plastics Friday for, what day is today? The 21st, 22nd? See, I'm on vacation, I've lost it, of August. Send us your questions if you have any, and everybody enjoy this beautiful August day.